Hi, my name is Hadar Lev Tov. I'm assistant professor here at the University of Miami, Department of Dermatology. I spend most of my time here doing two things. One is taking care of patients in our clinics, the general dermatology clinic as well as our wound center. And then I spend a significant amount of time conducting research. I think if you think about a wound, you think about something that is oozing and smelly, could be painful. And if you think about that, then you realize how much suffering it causes a patient with a wound that does not heal. And that's a big problem to me. These wounds cause a lot of suffering for the patients, a lot of frustration for the doctors trying to heal them. But also from a system point of view, they're a very big burden, especially economic burden. And so to me, that's a reason to get involved and try to find better solutions, both in terms of treatment, and in my case, I'm particularly interested in prevention. So my work at the Wound Center is actually very gratifying. We see here as one of the largest wound center in the country and probably one of the leading ones. We see very complicated wounds. We have people travel from actually all around the country to come to see us for wounds that have been present for sometimes years, and have seen many doctors, and they just can't get them to heal. And when you get these kind of patients with these kind of wounds, it's not a one sort of silver magic bullet that will solve the problem, and you have to think about it more holistically on one end, and then try to deploy various treatments. And that's where we're lucky, because being at the cutting edge of research, we have the newest and most advanced interventions for wounds. We have various grafts, various medications, hyperbaric oxygen, and on and on. And so, to me, probably one of the most gratifying scenarios is when we take a patient with a wound for a few years and actually slowly, week by week, get the wound to get smaller and smaller until we get to the point where they heal. We have a tradition at the Wound Center. When a wound heals, we ring the bell, and that's one of my favorite sounds in clinic. So I think we have here a great opportunity, because if we see a wound that doesn't heal, I can go next door and talk to another doctor who's a wound expert. I can talk to a surgeon who's a wound expert. I can talk to a podiatrist. I can talk to some of our nurses, as well as our basic scientists. So what is my message to you, people who are viewing this video? I suppose is that we are very open to collaboration. We like to work with other people, and because at the end of the day, that brings better solutions for our patients. And so I invite anyone who wants to collaborate on wound healing or any other type of research to approach our department at any level. If there's patients who are suffering and would like to get maybe a second opinion, medical students, residents, whoever you may be, our department is actually open to a lot of venues of collaborations. So I'm going to wish you good healing.